News this morning, researchers are sounding the alarm about the indirect risk the pandemic poses to the physical, social, and mental health of young people. Dr. Peter Gill from the Hospital for Sick Children in Toronto joins us this morning. Doctor, really appreciate your time. Thank you so much. So your team looked at a range of data which suggests one of the most significant effects of this pandemic is limited access to health care. Your own hospital saw a decrease in pediatric emergency department visits by 30% in March and 62% in April compared to the same time last year. What are the knock-on effects for young people when access to care is reduced?
Thank you for having me here. That's an important question. So the possible adverse physical effects seen in children and young people include delays in seeking care for non-COVID-19 related illnesses, which can lead to children presenting later with more severe illness and death. And we've seen this in other countries such as Italy. There's also been a concern with widespread delays or omissions of routine childhood vaccinations, which can threaten herd immunity in our population. And last, there's also the possibility of missed developmental milestones, developmental delays because of lack of routine child health checks.
And it's not just physical health, though. How's the pandemic creating a greater risk for mental health and social well-being in young people?
Yeah, so that's certainly been a key concern, and the potential social and mental health implications include the forced isolation and economic uncertainty, which leads to increases in family violence and can contribute to both mental and physical trauma. School cancellations that may heighten food insecurity and vulnerability, particularly for children who rely on meal programs. And that lost social interaction and lack of structured routine may lead to increased rates of screen time, less physical activity, and increased rates of depression and anxiety amongst young children.
You didn't just lay out the facts. Your research also lays out recommendations for healthcare providers and policymakers. So let's show these to people. Develop responsive and adaptive healthcare systems, communicate clearly with children and families, and make data-informed decisions. What specific action should be taken right now? If you had the ear of the people who can make these decisions, what would you want to see immediately?
So first and foremost, it's important to communicate to children and families that healthcare services are open and accessible. We have to continue to provide essential healthcare services, such as vaccination and chemotherapy during this pandemic. So if you're worried about your child, please seek care. Secondly, we need better communication with families to explain why decisions, such as school reopening, are being made. Parents and families need to trust and understand that the factors used to make these decisions align with their own values and preferences. And thirdly, we need robust data collection systems to help us generate information that we can use to inform future decisions. So for example, with camps reopening, we should be making an effort to collect data to understand the potential impact of reopening on children and their families.
Let's just underline this point one last time. I found myself with a child who was ill during the pandemic and worried if I should bring them into the hospital to see a doctor. We decided not to bring our son in, and it turns out the problem passed. So what would you tell parents today who might need to come to see their doctor at the hospital but are worried that COVID-19 is still a very real threat?
So that's a great question. I think whenever a parent's worried, it's really important to take that seriously. So first, there's been lots of efforts and initiatives on virtual care and telephone care. So if that's a real concern, I would look at an alternative option like that initially. Other emergency departments have been creating virtual emergency departments where you can actually seek care completely virtually. But ultimately, I think it's a balance of the two risks. But if a parent is worried about their child's care, it's about going to talk to healthcare providers, but also being mindful that we have to do a better job to communicate what we're doing to reduce the risk of COVID-19 for children and families.
Doctor, I'm glad we could end on that point. Thank you very much. We appreciate your time.
No problem. Thanks for having me.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.